You get four options when you're talking about replacing teeth. Not all of them are good. Number one is to do nothing. A lot of people don't like that, especially with front teeth. Number two would be something removable, like a partial denture. A lot of people don't like that idea necessarily long term. Third option would be a bridge. Generally what's done with a bridge is that the dentist would drill away parts of the adjacent teeth. They make crowns for those teeth on a false tooth. They call it a pontic tooth. They put it between them and then they insert it and cement it down as one unit. Downside of that is that they're touching teeth that don't need to be touched. They can't floss between the teeth, so hygienically it's not necessarily ideal. So a lot of people don't like that idea. The last option is the dental implant. When people are thinking about dental implants, you can think of it as an artificial root of a tooth. It's a screw. It's made out of titanium. Good thing about implants, unlike bridges, is you don't have to touch the adjacent teeth. You can floss around the teeth, so hygienically it's ideal. And once they integrate, which is at 95 to 99%, they're virtually with you lifelong. Based on about 35 years of human experience with implants, it really is the gold standard nowadays. Now the downside of implants is the time. You gotta take out the tooth, heal, place the implant, heal, and we do have potential ways of shortening that process. One's with something called immediate implant placement, where you take out the tooth, and if the underlying bone is adequate, you can place an implant that day. Cuts in half the whole time, also decreases the number of procedures that you might require. Usually if patients are good candidates for that, if they're going down the implant road, that's a good, predictably successful way of handling an implant. Another way is something called tooth in an hour. It's basically where you take out the tooth, and if the underlying bone is adequate, you place the implant. As you're placing the implant, you're actually measuring with a machine how much torque the implant screw is going into the bone, and if you achieve an acceptable amount of torque, you can place a tooth on it that day. It's a temporary tooth because you're still waiting for that immediate integration to occur. Then you have your dentist make a final tooth, but you're not without a tooth during that healing phase, and you're not with something that's going to be removable during that period of time. We have the technology that has been developed over the last 2 decades, and at this point we've mastered the ability to rebuild all these patients to the point where they can have these options.